36 hours of nonstop winds just pounding us here. Yeah, we had no electric, no water, no comms, no cell phone, nothing. My name is Don Hiller. I'm a captain with the Monroe County Sheriff's Office in the Florida Keys. After the hurricane, we had no communication with anywhere in the mainland. So we just started to try and clear the roads. There was a downed tree in the middle of the road, and I had to climb over it in order to start moving it around and make access to the road. And I ended up slipping off this tree and landing on my shoulder. Didn't think much of it, just hurt myself. Throughout the next several months, the Florida Keys were just devastated, and we were doing much of the recovery and work, and my own personal house. I'd work all day and have to go back and work at my house, which was destroyed. Never really made much worry about my shoulder. Didn't think much of it until probably December, when it was really, really bad. I couldn't sleep. I could hang my arm like this and it really wouldn't hurt. But if I lifted my arm past this, forget it. I was in terrible pain. So I finally got it looked at, and they said that I had screwed up my rotator cuff and have a tore bicep or something. So I've had horror stories with friends and other colleagues that have had rotator cuff surgery, and that's probably one of the reasons I delayed getting any work done, because I knew once I was done, I couldn't work on my house, I couldn't come back to work, I knew I was going to be shot for 6 months or more.
When Captain Hiller saw me, he was doing a fair amount of manual work for a police officer at that time, just helping people, rescuing and salvaging situations where all of a sudden now we're using our shoulder or other joints in a pretty demanding manner. He had a sudden onset of pretty severe pain, and the MRI showed that there was a partial cuff tear. His pain was severe enough that we really needed to offer him something.
Dr. Badia explained that he called it the patch, and was a procedure that I was a good candidate for, he thought.
REGENETEN is a bioinductive implant. It's the size of a postage stamp. It's designed to act as a substrate for tissue ingrowth. So basically what we do is we lay it on the diseased or partially torn rotator cuff, and then it will thicken, and it will gradually disappear actually over a 6-month period. But during that time, you've got essentially new tissue with the collagen, the molecules aligned in the right orientation to basically augment or heal the rotator cuff.
I got out of surgery, and I was told as soon as I have pain to take a pain pill. I never took one pain pill during this whole procedure, throughout, from surgery until I was cleared to go back to work. So I had zero pain, literally zero pain. It was amazing. I have a son that's very active in sports. Every day we throw the baseball. Well, that was another worry. I couldn't throw the baseball. Well, we're throwing the ball every day again now, and it's been less than a year since I had my surgery. The results were pretty impressive to me. I find that the sort of more cutting-edge surgeons have embraced this REGENETEN technology because they understand how the interplay of the biology of the rotator cuff and how it can help the patients. My goal was to get back to work and be able to get back to my family and get back to my recovery, and that seemed to work out pretty good. And what's interesting about him is he basically said he never had pain. Even post-op, it was quite minimal. And his recovery was very quick, and we actually discharged him even from the rehabilitation process, if I recall, within a 90-day period. He's a great example of what we can achieve with the REGENETEN implant. My name is Captain Don Hiller, and since my procedure, I've been able to live my life unlimited.